Are you getting lower back pain when you lie down flat on your back, making it next to impossible to get a good night's rest or even simply relax? Well, in today's video, we're going to explain what's happening and what you can do to fix it. If you're new here, welcome. I'm Michael Sciatica, the lead osteopath and spine specialist here at Back in Shape. And today we're going to explain the two main things that are happening that cause this pain and what you can do to fix it. The first thing that's happening when you're lying down on your back really involves a dull, aching feeling that might build up slowly over the course of a few minutes to maybe a course of a night. And what's happening here is when you're lying down on your back, the spine, which is the lower spine, which is this green section here, is flattening out like so. And as it's flattening out through here, you stretch all of the little ligaments and disc fibers on the back of the spine, and that can create some inflammation, some irritation, and slowly over the course of time as you're led there, this pain or discomfort will really start to build up. And for some, it feels like a bit of a pressure building up right down here in this lower back area as you're lying down. And the big conditions that might be causing this would be if you've got any sort of disc injuries or if you've got any spinal stenosis that's happening, particularly at the L4-5 segment of your lumbar spine, although it can also happen at L5-S1. But generally that's because this segment, which is the junction between this green one here and this green one here, really flattens out quite a bit when we lie down. And that creates this stretching on the back here through the vertebra like so. The second pain is really a much more instant thing. As soon as we lie down, we get that sharp pain, maybe a bit of stabbing sensation right down there in the lower lumbar spine. It can be accompanied, for those of you that have sciatica, with shooting pain into the hip and further on down the leg, literally within a few seconds of lying down. And most commonly, we find that this is generally going to be associated with a lower lumbar issue, more like L5-S1, which is the last joint in the lumbar spine. Often when we have lower back injuries, we have a degree of instability at the segment that's injured. So let's just suppose it's L5-S1 down here, that's unstable. But some of these other joints up here are a little bit more stiff. So as we lie down and the spine moves into an arched position, which we'll get onto reasons for that later, it creates a hinging point down at this bottom part, which brings, and you can't quite see it very well on the spine here, but it brings these two facet joints between the green and the orange closer together. And the effect that that has in the spine, if we look slightly higher up, is when we arch the spine, if you look at this little space down here, it makes the hole smaller. And that arching, making the hole smaller, will either pinch the nerve specifically. If there's some disc material in that hole, then it's going to pinch and create more pressure there. Sometimes it can just be a buildup of inflammation that's accumulated through the day, and as you lie down and that arching takes place, it suddenly makes that hole constrict quite a lot, and that creates the aggravation and pain that you experience. It all comes down to a degree of instability or hypermobility at a segment that is injured, and again, most commonly this tends to be the L5-S1 segment. One of the additional reasons that this particular type of pain occurs is because we're sat down all day. Our hip flexors are tighter than they otherwise should be from hours and hours behind the desk, and as we lie down, our hips here simply cannot straighten all the way because there's tightness in muscles like the psoas or the rectus femoris, which is a muscle that runs along the front here down into the kneecap. And so as those hips try and flatten out, the spine gets pulled up into this position because they simply don't have the mobility. Again, conditions that might be relevant here could be an L5-S1 disc injury, it could be a degree of stenosis at this particular segment, it could be things like spondylolistheses, which are a slippage forwards, a shearing forwards, and we've got a full podcast episode that explains these, so if you're interested in that condition, you can check that out, link in the description. But these are the sorts of conditions occurring generally at L5-S1 that might give you that sort of sharp pain when you lie down on your back. So the important question now is, what are we going to do to stop this happening? And really there are a couple of things that we can do to make an immediate improvement in the pain that we're experiencing when we lie down flat. But first, it really stems from an understanding of the lumbar spine. And we have to understand that our lumbar spine should have a smooth backward bending curve through it. This means that when you're lying down, there should actually be a little hollow. There shouldn't be too much, we shouldn't be pulled into extension, but there should be that natural curve. And the primary thing we're going to do here is to support that curve, because both of these causes of pain, the more dull ache pain, generally comes from a flattening of that curve, eliminating the natural curve. And the other more sharp pain, maybe with remnants of sciatica, comes from arching the spine too much. And therefore using a small rolled up towel, like we talk about the towel stretch for lower back pain, done for 3 to 5 minutes at a time, as you're probably seeing on the video, on the video right now or shortly, will help support that natural curve. The problem with lying down on your back and elevating the legs, as many will do, is that it flattens the lumbar spine. But the problem with having the legs flat means that the spine is more likely to arch. So by having the towel to support the lumbar curve and then having the knees slightly bent, like you're seeing in a moment, or I've already seen, it really helps you just balance that position of the lumbar curve, take pressure off the discs, take pressure off the ligaments on the back part of the spine so they're not being stretched, and hold a set, normal, neutral position. Now you can do this particular towel stretch many times a day, 3 times a day. You can do it for 2, 3, 4, 5 minutes. The first time you're trying it, you might find that it's a little bit uncomfortable, and therefore you can only do it for maybe 20 seconds, 30 seconds at a time. But slowly over time, this stretch, this towel stretch, is an absolutely fantastic one that you can lean on for long-term back health. On top of the towel exercise done daily, we can also incorporate some other strategies to help you reduce the inflammation, because fundamentally it comes down to excess inflammation being in this area, and as those holes get filled up, we get the pain, either immediately because the hole got smaller in the case of the arching, or slowly building up over time because the spine has been sat flatter than it should be. And so using contrast therapy helps you calm that down. And we do that by doing some hot, then some cold, then some hot, then some cold, always trying to finish on cold, and about 3 to 5 minutes of each done immediately over the lumbar spine. Now, if you have pain in the hips or pain down the leg with sciatica, then you still have to focus on the lumbar spine, the origin of where those symptoms are. And for a full guide on how to do contrast therapy, there'll be a link in the description step by step, and you can follow that after this. But you can do that again after doing your towel exercise or towel stretch a couple times a day. It'll really help calm things down. The final thing to think about is going to be sleeping position. And generally speaking, sleeping on your side allows you to more effortlessly support a neutral spine. So we want the spine to be in that position. We don't want to be tucking our knees up into the fetal position. Why? Because that will flatten the lumbar spine. We equally don't want to be arching too much either. But if we lie in that neutral position like so, and for ladies in particular, having a small towel underneath the waist so that our pelvis doesn't rock one way or the other, can really, really help. We can then look at having a pillow between the knees as well to decrease tension on the glutes here. And that can also help just set the spine in a more comfortable position, a more neutral position, so that you can rest more easily with less pain. Ultimately, whether you're getting the dull, aching pain that's building up over minutes to hours, or whether you're getting that immediate sharp pain in the lower back or sciatica down the leg when you lie down, it comes down to the simple fact that you have a lower back injury. And we need to do the correct rehabilitation to rebuild strength and stability in that spine. And if you want some help with doing this, then you can always check out the full free Back in Shape Masterclass, which is linked in the description. You can check that out. And that's a full video that you can follow along with, which will start you doing the right sort of exercises to rebuild that back. If you are lucky enough to only get a little bit of pain when you're lying down, then this is a cue for you to start making some change, and you can avoid things getting a little bit more serious and a little bit more severe during the daily waking hours and getting in the way of the things that you want to do. If you need a little bit more guidance, then you can always check out the Back in Shape membership, which is a full detailed program where we help members just like you fix their back pain from home. And for more details, again, you can check out the link in the description. Hopefully you found this video pretty helpful and now have a better understanding of why these things are happening in your lower back, and you can move forward accordingly with some of those steps, and maybe check out the masterclass or the membership too. Thanks so much if you made it this far. If you know someone else who's been struggling with their lower back pain, then do share this video with them. And remember, there are some of those videos linked at the end of this video, either here or here, that you can check out afterwards.